How's everybody doing tonight? Thank you, first of all, to Chesapeake Urology and for Boston Scientific for helping organize this for us tonight. I want to give a special thanks to all of you listeners who are tuning in live. It's great to see such great participation. Also, special thanks for those of you who are watching the recording of this webinar. This is a really great, important step in not only learning more about a condition that affects so many men, but also for really just taking ownership of your medical health and learning more about the different treatment options that are out there. I want tonight to be totally educational. I want us to get into some of the details that go over erectile dysfunction, starting from what is that, right? A lot of guys say, do I really have that? What causes it, and then really spend a lot of time going over all the treatment options. So we at Chesapeake try to be really comprehensive about this. There are some quote unquote men's health clinics who really try to peddle one treatment or the other, whether that be T-shots or shockwave treatments or injection treatments. We really try to take a detailed look and make individualized recommendations. But we're also proud to be able to offer the full spectrum of treatments for our patients.
Hey, Dr. Sharma, real quick before we get going, I just want to jump in. Hi, everybody. I'm Preston Brickner with Boston Scientific Urology. Just a couple quick housekeeping items before we get going. Most importantly, your participation is completely anonymous to all other attendees. No one's going to see your face or your name. They also won't see any of your questions you ask. They'll only be seen by myself and our presenters. We encourage everybody interactive presentation. So if you want to ask a question, please type it in your chat box. It should be at the lower part of your screen, and we will have time at the end of our presentation to answer them, and we will get to as many as we can. Also joining us tonight is one of our patient advocates, Skip Powers. Skip will tell you a little bit about himself and stick around for the question and answer period as well. Dr. Devang Sharma is your speaker tonight. Dr. Sharma, I know your time's in high demand. Thank you for the intro so far. And go ahead, sir. I'll turn it over to you.
Awesome. Thanks so much, Preston. So this is me. I'm one of the senior urologists here with Chesapeake Urology. I primarily see patients out of the Germantown office, but because of my subspecialty, I do travel around to most of our ambulatory surgery centers in Montgomery County. And I'm a Maryland boy, born, raised, went to public schools in Montgomery County, University of Maryland for undergrad, did my engineering degree there, and then was out and about for 10 years for medical school up at Dartmouth, and then down at UVA in Charlottesville for my internship residency and my subspecialty fellowship in andrology. So let's jump right in. Let's start with just what erections are and how they work. So an erection is something that happens with the passage of blood flow into the penis. When that happens from arousal, the penis gets longer, thicker, and harder. That's obviously something that we use from an early age and something that we'd like to continue to use for as long as possible. Basically, when you're unable to use your penis for sexual activity, whether it be intercourse or otherwise, and it's not satisfactory to you, that's ED. Okay, it does not have to be more complicated than that. But if you wanted to give it a hard and fast definition, the inability to achieve or maintain an erection that's firm enough to have sexual intercourse. Okay, so we do tend to kind of put that on a pedestal and say, are you hard enough to have penetration? Does it stay hard enough long enough for you to finish and things like that? But really what it comes down to is, are you able to use this in a way that is satisfactory to you? And for a lot of men, the answer to that is no. Okay, 1 in 5 men over the age of 20 are going to experience ED at some point in their life. And really, this is something that affects half of all men over age 40. So like I said, the erection is something that really starts with arousal. And I think before we get too deep into the ED treatment and the ED overview, I think it's helpful just to talk about the 4 parts of sex. The first part of sex is wanting it, right? The second part is getting and maintaining erection. The third part is achieving climax or orgasm, which really happens up here. And then for men, the fourth part is seeing something come out of the penis or the actual ejaculate. Those 4 are interrelated, but they're really different, right? Libido or desire is different from erections. Orgasm is different from erections, and ejaculation is different from erections. And we're really going to focus on the erections tonight. I know that we had some questions come in early talking more about orgasm, climax, and ejaculation. And while I do specialize in those things, we're really focusing on the erections tonight. So with appropriate arousal, the nerves carry the signals both from our brain to our penis and from our penis back to our brain to allow that communication for our body to work the way that it's supposed to. There are arteries that carry blood into the penis that allows the penis to get longer, thicker, and harder. There's a complex structure of supportive tissue around that that helps trap blood into the penis. That allows us to have a penis that is rigid enough to use for intercourse. When any of these things break down, whether that be the nerves that actually bring the signals to and from the penis, the artery that carries the blood flow into the penis, or that complex structure around that traps the blood within. When any of those structures break down, that can lead to problems with erections. This kind of goes through some of the most common causes that we see. Vascular basically means blood flow problems, right? So you can see a large portion of these issues are related to blood flow, and we'll go into how that can actually happen. Diabetes is another huge cause, and diabetes affects erections in a number of different ways. We'll jump into more detail about that. You guys will see medications on this slide. I just want to give a little bit of a caution to that. A lot of people will, read crazy things on blogs and stuff about how certain medications are the cause of their ED. What I'll tell you is, yes, there may be some contribution for that, but you have to be very, very careful. Please do not stop taking any of your medications that you may be on for things like high blood pressure or depression or anxiety. There are certain medications that treat those conditions that can be associated with ED, but those underlying conditions, high blood pressure, depression, anxiety, are also related to ED. So please don't stop or change any of your medicines without reaching out and talking to your prescriber. Trust me, your doc who gave you these pills wants to know if you think you're having a problem with them. So please just bring it up before you make any type of changes. Okay. Let's talk a little bit more about the diabetes. Okay. Diabetes can affect your erections, whether it's under good control or not. Okay. Even a diabetic with good control has changes that happen on the microvascular level and changes to nerves. That is highly dependent on not only how long you've had the diabetes, how good your sugar control is. It can depend on other things that affect your vascular system, whether that be high blood pressure, cholesterol, smoking. If you have a combination of these conditions, it can worsen the effects of diabetes on your erections. Age plays a role as well. So even if you take all of these diseases out of the picture, there is a natural age-related decline in the quality of our blood flow to the penis. We've actually studied this with, penile injection studies where we do this in 20 and 30-year-olds and see that the quality of the blood flow is different than it is in our 70s and 80s. So some of that is natural, but ED is not a natural part of aging. Everybody gets this. So if you do, please don't write it off as a natural part of aging. There is a strong association with heart disease. So an association just means ED doesn't cause heart disease, right? And heart disease doesn't necessarily cause ED, but they often go together. And one of the important things to know is the ED typically comes first, okay? So you may not have had a heart attack before. You may not have a diagnosis of coronary artery disease or anything like that. But if you have ED, that actually may be one of the first signs that other types of vascular disease or heart disease are down the road. And one of the things that we try to assess when we see patients with ED for the first time is what else might be going on in your health that may affect you in other ways in the future. This is a great slide. If you look at these rings at the bottom, they show you the relative size of the blood vessels that supply different parts of our body. The smallest one is the penile artery. you can see it is way smaller than the blood supply to our heart, to our brain, and to our legs. Apparently, whoever designed us thought that having sex was less important than, using your brain, getting heart and blood flow pumping and running from bears. But this is important to understand because when you have changes to these blood vessels, one of the first organs that is affected is the penis. So if you have a long history of high blood pressure, if you have a long history of diabetes, there are changes to the quality of blood flow that happen to these blood vessels, and they happen more common in the smaller ones. When we talk about treatment for ED, we always talk about risk reduction for cardiovascular health. And that means just get healthier, right? ED can sometimes be a precursor of other types of disease, and it should be a wake-up call to just be honest and reflect on how well you're taking care of yourself, okay? I think all of us have room for improvement with taking a critical look at our diets, right? Eating more fresh fruits and vegetables, increasing fiber in our diets, really, really taking the exercise to heart. I hear so many patients saying, Doc, I'm on my feet all day long. I got a hard job. I get my 10,000 steps in. Looking at a step counter and living an active lifestyle by living, on your feet on a regular basis is not the same thing as exercise. The American Heart Association, which is the professional group of docs who tell us how to not die of a heart attack, they recommend 150 minutes of moderate intensity cardio per week. That ends up being 30 minutes Monday through Friday. So really be honest with yourself and think about if you're getting to that or not, okay? It may not be the magic answer to your ED, right? But if you get closer to that goal, that is going to really help support a healthy sex life. Weight loss is important. I think, most of us Americans can stand to lose about 10% our body weight. Talk to your doctor about specific recommendations for that. Quit smoking, all right? Of the many things that smoking can affect, your erections should be number one on that list, okay? Everyone has talked to you about, smoking causing heart disease, causing lung disease, causing cancer, contributing to heart attacks and strokes. For whatever reason, guys tend to just not hear that stuff or not care about it as much. But when guys hear that their smoking is affecting their penis, that's a good reason to stop, okay? Stress can play a role too, okay? Some people say like, Doc, you telling me that like my ED is in my head? Like, what do you mean stress is important? In the world of erectile dysfunction, stress is a chemical, okay? If you are stressed, you actually have adrenaline, which is a hormone that comes from your adrenal glands surging through your bloodstream. When we see patients who have erections that are lasting too long, that happens in people who sometimes use injection therapy, that can happen to people who have certain medical conditions like sickle cell disease. They see us and we actually inject the penis with adrenaline. That's the same stress hormone that's coursing through your bloodstream when you're in a stressful situation. And that could be fairly subtle. Like if you're in a sexual encounter and you're nervous and all of a sudden, instead of thinking about your partner and the situation that you're in, you're thinking about your penis and whether or not you're going to be able to maintain your erection. That is a chemical that's surging through your bloodstream and actually physically making your penis softer. So stress reduction can play a big role in people who have mild to moderate ED. So we'll touch briefly on low testosterone as well. It is within our AUA, or the American Urological Association's guidelines, to be looking at testosterone levels in men who are coming in with erectile dysfunction. That means that if you haven't had it checked before and you're struggling with erectile dysfunction, you should. It's a very easy blood test. It does have to be done in the morning on an empty stomach, but men with low T can have not only erectile dysfunction, but other symptoms of low sex drive, low energy, down, depressed, or irritable mood, trouble with body composition, like gaining weight around your waistline and losing muscle bulk. That can play a bigger impact in your overall health and quality of life. And sometimes the way that we find it is just a basic routine check when we're taking care of guys with ED. There's a lot of risk factors for low T, okay? If you're obese, if you're diabetic, if you have high blood pressure, high cholesterol, these are all common risk factors for low testosterone. One of the most common ones that I don't see on the slide is sleep apnea. Nobody wants to admit or think about the fact that they may have sleep apnea, but all you guys who snore or catch elbows from your partner in the middle of the night, please think about that. Undiagnosed sleep apnea is one of the most common reasons for getting up to pee at night and for having low testosterone. So that's something to just get checked and think about. If that's something that needs treatment, there's lots of ways of doing it, whether it be gels, patches, pills, injections, beyond the scope of what we're talking about tonight. Let's talk a little bit about erections and prostate cancer. So this is really important for all of my prostate cancer survivors and for patients who are really considering the best way to take care of their prostate cancer. All of the treatments that we have for prostate cancer have a significant impact on erections. It has nothing to do with, how your surgery went or, how bad your disease was. It has to do with the anatomy. The nerves that go to your penis, remember, that carry the signal from your brain to your penis that it's time to have sex. They travel so close to the prostate, it can be very difficult to leave them completely unharmed. We do have advances in prostate cancer removal surgery and the radical prostatectomy that allow us to see these nerves better and to be more gentle and careful and do nerve sparing surgeries where these are left behind and allowed to heal and regenerate afterwards. But when a prostate is removed, that connection is temporarily disconnected. The nerves are often left intact, but because they're stretched and move around and manipulated, they can go to sleep or stop working for an extended period of time after prostate surgery. If you've had a radical prostatectomy, which means complete removal of the prostate for prostate cancer, you have probably had some nerve-related changes. Those can heal and regenerate over the course of about 12 to 18 months after your surgery. But you can see from these pictures, when the prostate is removed, there's this bridge that needs to be gapped. And we do sew that together. It's very hard to do that for the nerves. And sometimes you don't have a full recovery. If those nerves are not intact, pills don't work, right? Pills really just help your body improve blood flow to the penis, but they're still reliant on those signals coming from the brain to the penis to get hard. When there is nerve damage, and that can be from prostate surgery, that can be from prostate radiation, that can be from diabetes. When there is nerve damage, the penis never gets the signal that it's time for sex, and the pills just don't work. Okay. There is a lot of men after prostate surgery who are dealing with so many things, right? Whether it be just the burden of having dealt with and survived cancer, or the physical changes that happen after surgery or radiation treatment, that it can sometimes be difficult to prioritize things like your sexual health. But this is one of the biggest impacts on men's quality of life after treatment, and something that we absolutely care about. If you have not had a discussion about this with your surgeon, then please reach out and talk to a subspecialist who does survivorship for a living. Okay. A lot of partners like myself who have andrology training, this is what we do. A lot of the prostate cancer surgeries are done by our partners who specialize in this, who specialize in robotics. I specialize in survivorship. So a lot of these concerns, they're talked about in a different way when you're talking to somebody who does this for a living. And don't be shy about it. There are people who just do this for a living. Let's go into erectile dysfunction and Peyronie's disease. So Peyronie's disease, you guys have probably seen the curved banana commercials. This is actually a genetic thing. This is something that runs in families and people just don't really realize it. Some men develop scar tissue in their penis from routine sexual activity. That scar tissue can lead to a hook or a bend that is obvious when you have an erection, okay? When you have this, there are a number of different treatments out there. There are injections that can be done inside that scar tissue to soften it up, that can work in conjunction with some exercises to straighten and stretch the penis. Oftentimes, the treatment for this overlaps with the treatments for erectile dysfunction, because when you have these structural changes to the tissues of the penis, we talked about the three components that are important for erections: nerves, blood flow, and the strong tissues around it that help trap blood within the penis. Well, this affects the last one. Those strong tissues, if they develop scar tissue, they're not as elastic, they're not as stretchy as they should be. And if that part does not trap the blood flow in, it can make it so that the penis is never hard enough to penetrate. Or if you get to that level where it's hard enough to penetrate, it doesn't stay that way long enough for you to use it. So men with Peyronie's disease are often noticing that their erections are getting much weaker. Okay. Let's start talking about treatment options for ED. I'm glad that this slide is included because I'm sure most of you have heard these commercials about shockwave therapy, and it sounds almost too good to be true, or it sounds like it could be a scam. And, there's a lot of nuance to this. This is a therapy that is offered. It's still considered to be investigational by our professional societies, and it's not approved by the FDA. But it is something that has been offered to men for the last 10 to 15 years. It's done a lot in Europe, and it's actually considered one of the first-line treatments in Europe for men who have mild to moderate ED, right? So if your erections are not that bad and you're looking for a little bit of an extra boost, then that might be an appropriate therapy for you. If you're somebody who can take pills and they work well, but you can't stand the side effects from it, this might be a therapy that works well for you. Or if you're somebody who's just interested in seeing if you can turn back the clock a little bit on this ED, it may be a reasonable therapy for you. There's still a lot that we don't know about it. Okay, we're very clear about that when we counsel patients about this. There are still ongoing studies that are being done in our region for this shockwave therapy. It's important to remember that not all machines are created equally. And unfortunately, a lot of these clinics where you hear marketing on the radio, they may not be using a machine that actually delivers the appropriate amount of energy to the penis, meaning they're selling you something that may or may not actually work. So if you're interested in this, feel free to schedule a consultation to talk about it. It's not something that's really mainstream in the United States yet, but it's something that may be a reasonable option to consider, again, really for guys who have milder ED. Other things like stem cell therapy and plasma, platelet-rich plasma, are really much more investigational. There's much less data on that. It's not really mainstream anywhere yet. So if you're being offered that, really be very careful. Know that there's not a whole lot of data to support that. And if you're interested in those types of treatments, I would really encourage you to find a center who's offering it as part of a clinical trial. These are the more mainstream treatment options that really we've had available to us for quite a while. There's been some advancements or innovations in all of them, and we'll be talking about those tonight. Let's start with pills because that's really where most people start. Beyond that, we will be talking about injection therapy. We'll talk about vacuum erection devices or the penis pump. We'll be talking briefly about urethral suppositories, which is a medication that can be placed inside the opening of the penis. And then we'll end with a detailed discussion about penile implants. We'll start off with medications. Everybody should be familiar with Viagra, Cialis. These are brand name medications for erectile dysfunction that have been on the market for long enough that they're now available as low-cost generics, which makes them really easily accessible to anyone who has a prescription for them, okay? These are low-cost generic medications that are designed to increase blood flow to the penis. As we talked about previously, they really are reliant on the nerves. And that means two things. That means the physical nerves that carry the signals from the brain to the penis, but also just your state of mind. I do have some patients who take the pills and are just looking at their penis and waiting to see if they're going to get an erection or not. They don't work that way. These are pills that are taken on a timeline. So typically 1 to 2 hours before sexual activity. If you think about how long it takes for like a Tylenol or an Advil to kick in, it takes at least 30, 45 minutes for that to start working. In the same way, it takes a while for a pill to go from your mouth to your stomach, to your gut, to your bloodstream, to your penis. So whether you're using sildenafil, which is the generic for Viagra, tadalafil, which is the generic for Cialis, you have to take it at least 1 hour before sexual activity. Sometimes if you wait too long, it washes out of your system. And by the time you're going around to sexual activity, it's really not there to help you anymore. So one of the most common pitfalls with medication use is not timing things properly. Every pill needs to be timed a little bit differently. And if you're unsure, talk to your doctor about it, because that's one of the most common mistakes. Another thing to realize is that when you're taking these pills, some of them are affected by food. So that means one of the most common ways to take these is, you have dinner, you're thinking, hey, maybe tonight's the night, you take a pill, and then you try 30, 40 minutes later. Over the counter, or not over the counter, but generic Viagra or sildenafil, it really doesn't work that way. Food blocks the absorption of some of these pills. So even if you put 100 milligrams into your mouth, you may only be seeing 20 or 30 milligrams at your penis if you're on a full stomach or if you've had dinner recently. These medications also have some common side effects. Most of them are really mild, and they fall under the category of being more of a nuisance or a bother than a serious threat to your health. The most common side effects are headache, flushing, which means feeling red or hot in the face or chest. A lot of men complain of a stuffy nose. It can cause a little bit of heartburn as well. You cannot take these medications if you're on some less common medications called nitrates, which some men use on an emergency basis if they're having chest pain related to their heart, or if they're on less common blood pressure medications that have nitrates in them. You cannot take them at the same time because they will cause such severe drops in your blood pressure that you may end up in the ER from a fall. You have to be a little bit careful if you're on certain prostate pills. So common prostate pills that are within the alpha blocker family, things like tamsulosin or Flomax, can also interact with these ED medications like sildenafil and tadalafil and cause some lowering of the blood pressure. So typically what we do is we ask patients who are on those medications to space things out so they're not taking them at the same time. Just be mindful of these interactions. This is something that you can talk to in detail with your pharmacist or with your doctor. All of us do take a detailed look at your medication list before prescribing these medications. Let's talk about injection therapy. So, the pills are great when they work. When they don't work, we then make a big transition into talking all about the advanced treatment options that are out there. The first one that we'll talk about tonight is injection therapy. This is typically something that is done about 20 minutes before sexual activity. So this is a prescription medication that, again, typically comes from a urologist. It's a medication that oftentimes needs to be refrigerated. When you want to have an erection, you go to the refrigerator, you drop a particular amount of this medicine, you use a very, very small needle and a syringe that's provided with the medication, and you inject it into the shaft of the penis. So just like you see in this picture, along the side of the penis, the needle goes in. If you see here, this shows you kind of like a cross section or a penis cut in half. There are two rods at the top that get hard and filled with blood for when you have an erection. There's one rod at the bottom that carries the urine. So as long as the needle hits one of the top two, that allows the medication to dilate blood vessels within the penis, basically improving the blood flow to the penis, whether or not you have nerves present or not. So this is a very common treatment for men who have had their prostate removed because of prostate cancer, because it can bypass the nerve problem. This is not a great treatment for men who have ED because of an underlying blood flow problem. So if the cause of the ED is things like, hey, you may have high blood pressure for a long time, you may have had diabetes for a long time, and those things may decrease the quality of the blood flow, think of this as kind of a stronger version of the pills that go directly into the penis. But if the underlying problem is that your blood flow is not good, think of it as having low water pressure. You can crank the dial as much as you want, but if you don't have strong water pressure, you're never really going to get that level of rigidity that you're looking for. So men who do injection therapy, they often find that they run into some issues. These are typically mild, but when you have the injections, you can have a little bit of pain or bruising or swelling at the injection site. That's typically minor, and it's something that patients get used to. For men who choose to stay on injection therapy for a longer period of time, you can run into some side effects or complications related to that with scar tissue. If you inject the same spot over and over again, it can cause that area of the penis to just feel tough, and it may not expand as naturally as it would, in a normal state. That can cause difficulties in achieving an erection if you have too much scar tissue within those cylinders that get erect. If you have scar tissue that's just in one spot, then it can also act similarly to Peyronie's disease, where there's a curve that develops as a result of the injection therapy. Injections are also a much higher risk compared to pills when it comes to priapism. That's an erection that lasts longer than 4 hours. So a normal erection after an injection can typically last for up to 1 to 2 hours. It may even last beyond climax or ejaculation. That's okay. But an erection that lasts for 4 hours or longer is not okay, because that means the blood flow is just trapped in the penis for too long. That can cause permanent damage if it's not addressed, really in an emergency situation. So if you're using these injections and have erections that last beyond 4 hours, that's really an indicator to get up, go to the emergency department. The way that's treated is typically more injections of adrenaline, like we talked about earlier, to actually make the erections go away. If that's not enough, a urologist typically gets involved to talk about surgical options to get rid of that. That's not meant to scare you guys. It's very, very uncommon. It's just something that you need to be aware of. Somewhere in the magnitude of maybe 1 in 10 guys who do injection therapy may run into priapism at some point. Overall, we talk about when people use injection therapy, studies have shown that after about 2 years, 80% of those guys are not using the shots anymore. And people always ask, why is that? It's really a mixed bag. So if the shots work for you, then you may be part of that 20% who just sticks with them. There's a lot of reasons why people stop using them that may be related to complications, ending up in the ER for an erection that lasts too long, ending up with some scar tissue or some curvature. Sometimes it's just related to cost. These medications can be pretty expensive. If you get the branded medications from a commercial pharmacy, sometimes it's really too expensive to even try them. Oftentimes we can send prescriptions to what are called compounding pharmacies, where they make the medications in-house and they're able to sell it directly to patients at a lower cost. As long as you're getting that from a reputable compounder, that's a very reasonable way of getting the medication. And even with that, it can still be on the order of like $150 to $200 for a batch of medicine that lasts you, anywhere between 3 and 6 months. Obviously, the prices vary, but cost can be one of the downsides of this treatment. And then obviously, it's needles, right? I mean, most people, as soon as we flip to this slide, they see a needle going into the penis and they say, that's just not for me. And that's okay, right? When we talk about advanced treatments for erectile dysfunction, it's not like you have to go through the ringer and try all of these things. Usually the approach that I recommend for people is see what you can do about changing your lifestyle and supporting good, healthy erections naturally. While you're doing that, try medications and see if you can get them working. If they're not, then we think critically about why is that, right? Are you using them incorrectly? Are there other things going on like low testosterone that could explain why medication may not be working? And then once you get to that period where you're like, listen, I've tried this, we've thought about it, the pills are not working the way they're supposed to, that's when you start looking at some of these other treatment options. Injection therapy is the first one that we talked about. The vacuum erection device is another therapy that you should be familiar with. This is often called the penis pump. It's a chamber that you place on top of the penis before sexual activity. You use either a manual handheld or kind of a electronic mechanical pump that acts like a vacuum. and it draws blood into the penis, really just by sucking on it from the outside. That creates a longer, thicker penis that's filled with blood. It will not stay that way without putting a good hard ring at the base of the penis. So if you look at the first picture with the square around it, this is a vacuum erection pump that's placed over the penis. This is a handheld model that's controlled with a gray pump at the tip. There is a red band that's placed at the base of the penis after it's pumped up to the size that you want. That ring is what helps trap the blood flow inside the penis. The main advantages to this is that it can be pretty cost effective in the long run. You buy it initially and then you have it and you can use it for as long as you want. That can oftentimes be much cheaper than the injection therapy. It is a little bit cumbersome, so you have to travel with this. You have to use it beforehand. That can be incorporated as part of foreplay. Some guys are a little bit more self-conscious about using something like this, and that can cause difficulties just from a relationship standpoint, or just a practical standpoint of how am I going to do this, and then just walk out of the bathroom with a ring around the base of my penis. The erection that you get with a vacuum device is different than the erection that you get with pills or injections. With pills and injections, you're relying on your blood flow to pass into the penis more or less naturally. When you're using a vacuum device, you're pulling it in quickly. And when you put that ring at the base, it leads to a penis that's a little bit colder and a little bit more numb than what you would get compared to an injection or compared to a pill. It is oftentimes hard enough if you can get it pumped up properly and get the ring on properly, but the sensation can be different. These rings really only work if they're very, very tight. So I tell people a pump is a pump is a pump. When you look and purchase one of these, which you can do without a prescription, they sell them, online. They sell them at local adult sex stores. They're called vacuum erection devices or penile pumps for erectile dysfunction. They come in lots of different shapes and sizes. There are models that range from $80 to $500. I tell people not to stress out about the pump itself, because again, a pump is a pump is a pump, but the ring is the important part. And the rings are not one size fits all, right? So people are always looking for recommendations like, which one of these should I get? How do I get one of these? This is really no different from any other product in the sense that just be smart, be an educated consumer, look at something and get something that looks reasonable to you, but try no fewer than 6 different rings before calling it quits. Again, the ring is what traps the blood flow within the penis. These can be used in conjunction with pills. So for people who use pills and feel like they're getting close but are not quite there, this can be meant to give you that last extra boost of rigidity, make the penis a little bit fuller, and then in conjunction with that ring, give you some lasting power to go that last extra bit. But it's really contingent on getting a ring that is the right shape. I've had guys who use something as simple as a rubber band rolled over 3 different times. And then there are fancier models that are available that look like horseshoes and have different size bands at the bottom that run like $70, $80. You don't necessarily have to go that fancy. You can get variety packs that, come in 3 or 4 packs, but try no fewer than 6 before calling it quits with this. This does require a little bit of a learning curve and an adjustment period, but I would say if you give it a good, honest try, somewhere between 50 and 80% of people will be able to get an erection that is hard enough to use for sex with something like this. A urethral suppository is a very reasonable option for people who use shots or the shot works. Oftentimes when we do shots, we do the first one in the office, so you'll know if it works for you or not. But if you can't use needles because you just can't get over that comfort level of putting something sharp into your penis, or maybe you're on chronic blood thinners and every time you use the injections, you end up with a lot of bleeding or bruising, the suppository is a nice option because it's the same drugs that we inject into the shaft of the penis that are available as either pellets or gels that can go into the opening of the penis. So That is, again, an option for some patients who need to use injectables because they can't use pills or the pills don't work, but don't really want to use the needles themselves. The main downside to this is cost. So we talked about how injection therapy can be expensive and how we bypass that, or how we mitigate the cost of those drugs by sending it to a compounding pharmacy. These things can be even more expensive. So oftentimes Muse is the branded alprostadil. If you get a prescription for that, most of the time it's not covered by insurance. If it's not, these are probably about $70 to $100 per pellet. When you get them compounded, they can be cheaper, but we're still talking on the magnitude of maybe $20 to $50 for every insertion. The other thing that you have to be mindful of is when you have a gel or a pellet that's actually in the opening of the penis, that can spill out. And then you start worrying about, are you going to get this medication on your partner? So when we have patients who use these, we recommend that it's either used in conjunction with a condom, or you make sure that the medication is completely washed out of your system well before you actually have any penetrative intercourse. Pain is a common side effect of these. So that is something that goes away on its own for a little while. But again, if the pain is too much, then that can be enough of a mood kill where it just becomes kind of impractical to use something like this. The penile implant of all of the advanced treatment options is the one that has been shown to have the highest patient satisfaction. If you look at this, it can be intimidating at first. For people who have never heard about a penile implant, it's important to understand what this is. This is a minor outpatient procedure that's done to actually place a inflatable device within the penis. This is done by a urologist like myself through a minimally invasive incision, either on the top of the penis or between the penis and the scrotum. Typically takes somewhere between an hour and 2 hours to do, depending on how complicated the anatomy is or what prior treatments have been done before. Once the device is implanted and you recover from the surgery, which is typically something on the order of 2 to 4 weeks of surgical recovery, and then a number of weeks of practicing and getting comfortable with the device, this is something that allows men to have an erection that is as hard as you want, whenever you want, for as long as you want. So that's a distinct advantage over a lot of the other treatment options. This is something that is in your body at all times. It allows you to have spontaneity that is not there with some of the other therapies. So this allows you to have an erection without worrying about, running to the cabinet to find an injection, to find a pill, to find a suppository, to find your penis pump. This is something that's part of your body and can be used, again, whenever you want. The way that this works is there are multiple components. The penis is actually made up of 3 rods. There are 2 rods at the top that typically fill with blood that allow the penis to get longer, thicker, and harder during an erection. When we do a penile implant, we place cylinders within those 2 rods that replace that blood flow with fluid. So when you look at this implant, this has 3 parts to it. The first one is a balloon that holds fluid for when the penis is, or when the implant is not in use. These 2 cylinders are placed within the shaft of the penis. They're soft and down when they're not in use. When you want to have an erection, you find a pump that's hidden within the scrotum or the ball sack. This kind of feels like a third testicle or a third nut. You squeeze that, and what that does is it transfers fluid from this balloon into the cylinders of the penis. When those inflate, they get thicker and harder and create an erection. People always ask, well, doc, what's the chances of it working? That's not really the right question because you don't leave the operating room unless it's working. We test these things before you even wake up from anesthesia. The right answer is, doc, what are the chances that I'm going to be happy with an implant like this? And that's a much better question. Overall, I would say that more than 9 out of 10 people who end up with implant surgery are really happy with it. Okay. This is the closest thing to a cure that we have for erectile dysfunction, and something that all men who have troubles with the pills should be familiar with and should seriously consider. Now, the 9 and 10 who are happy about this, these guys, and you're going to hear from one of them tonight, these guys will often tell you, Doc, I wish somebody would have told me about this sooner. I wish I'd have considered this years ago. I don't worry too much about those 9 and 10. Okay. I do more than 10 of these a year, and I'm not in the business of making people unhappy with the procedure. So I want to talk about those 1 in 10. So of the people who sign up for implant surgery, some of those are going to be unhappy with it. And people always ask, well, why? What's the deal? So it's really important to understand how the implant provides the erection. It is independent of arousal. So what that means is we're used to getting an erection with some type of stimulation. Maybe you're thinking about something, maybe you're looking at something, maybe you're getting physically stimulated. When those things happen and you have an implant in place, you may feel a little, signs of life, but there's not going to be much engorgement. There's not going to be any changes to the implant itself. It is contingent on you reaching down and actually using the pump. Okay. That actually gives you a level of control that you don't typically have, right? So it doesn't matter if you've had a long, hard day at work. You can still get as hard as you want, whenever you want, for as long as you want. So that leads me to that final point. This erection that you have with an implant, it doesn't go away when you ejaculate or when you climax. A lot of men with ED, they actually also struggle with premature ejaculation, where they used to be able to last 5-10 minutes, but all of a sudden that's not the case anymore. And as we age, it's a lot harder to reach climax and then just go right back into having sex again. When you have a penile implant, you can orgasm and still have an erection. So you're not worried about losing it. You're not playing that game or that race about who's going to reach climax first and I'm going to be able to last long enough to satisfy my partner. This erection will stay there until you actually reach down, find the deflate button, which is on the front of the pump, push that, and release the fluid from the implant. Okay. We'll talk in a little bit more detail about the different types of implants that are available. The first one that we talked about is the 3-piece inflatable implant. I would say that that's probably the most commonly implanted device. There is a 2-piece implant that's available. We won't spend too much time talking about that. It does not necessarily get as rigid as the 3-piece does, and is typically used in people who can't get that third component placed into the abdominal cavity. It's usually related to prior surgeries like kidney transplants. The malleable penile implant, I think, is very important to talk about and to understand, because it is something that can be done a little bit faster than inflatable prosthesis. That can be more of like a 30 to 60-minute procedure. It is actually a quicker recovery with a lower infection risk, and it has less of a learning curve or rehab period. It's a great option for guys who are worried about whether or not they're going to be able to use that pump or rehab the device properly. It can also be great for men who have arthritis or are worried about their grip strength with their thumbs. This is something that is just 2 cylinders that are placed inside the penis, custom fit to your anatomy, similar to the 3-piece device, but there's no pump and there's no fluid. So the rods have to be hard enough to use for penetration all the time, but they're flexible. That's what the malleable part means. So think about this as a gooseneck lamp. You guys have all seen those lamps where you can adjust it and it stays in place. This is the same way. These rods always are thick. They're always firm enough to use for intercourse. When you want to use the penis for sex, you just straighten it out. And when you're done, you just bend it back. Okay. The satisfaction rates for that are fairly comparable to the 3-piece device. People always ask about, what about partners? Partners have a good satisfaction rate with the malleable device. It's a little bit lower than the inflatable, just because it's a little bit harder to hide, right? It's always in that firm state. So if you're shaped like an underwear model, if you're part of a nudist colony, maybe you want to consider not getting a malleable device because it can be harder to hide when you have that bump there. But in the same regard, if you're somebody who really wants to minimize the amount of anesthesia from a procedure, if you're worried about the rehab of an inflatable device, then a malleable device is a nice kind of minimally invasive option that offers similar results. Let's talk in a little bit more detail about what are some of the advances in the penile implant itself, because it's really come a long way. It has been available to men for really over 40 years. There have been more than 500,000 men who have received a penile implant. But one of the biggest advances in implant surgery has been the antibiotic coating that's used by the Boston Scientific products. This is something that I'm a big believer in. When we do implant surgery, one of the things that we always talk about and we're constantly aware of are implant infections. So when implants get infected, it is very difficult to treat those infections with antibiotics alone, and it often requires removal of the implant. Okay, we try as much as possible to prevent that. Okay, I am personally very anal and meticulous about infection prevention. I have my patients scrub their body once or twice with an antiseptic soap before surgery. I personally scrub the skin with an antiseptic soap before surgery. Before making any incisions, I have our anesthesia team do 2 different IV antibiotics. And I really am preferential to this product because it's coated with 2 different antibiotics that comes directly from the factory that stays on the device. And that has really been shown to decrease the risk of implant infection, which again is one of the most serious complications that we have to keep an eye out for. It's not terribly common, okay? Maybe 3% or less will run into an implant infection, but because it often requires surgery to address, we do everything possible to prevent that. And having that, reassurance of knowing that there are some antibiotics and some protection built right into the device is a big reason why I'm a big proponent of this technology. One of the kind of godfathers of our field who have really advanced and done one of the most implants has said that this antibiotic coating is one of the biggest advances in implant surgery over the last 40 years. It is something that's coated within the cylinders itself and within the pump, and that really has shown to reduce the risk of implant infections. I wanted to give you a quick video here about how the actual implant works. This is going to be an animation that shows the internal components, similar to the picture that you saw before, but it's actually in action. So when you look at somebody's body with an implant from the outside, it looks completely normal. This is a kind of X-ray view where you can see the components. He's pumping the device from the scrotum, and that's transferring fluid from the balloon that sits behind the pubic bone or next to the bladder into the rods that are in the penis. Now he's pushing that deflate button, and that releases the fluid from the penis and allows it to go back into the balloon. Okay. The next video that we're going to look at is, call it the HBO version, which is actual skin and a person. So you're going to see male anatomy here exposed. Let's see if we can do that one more time. This one here. And it's going to be the same thing. You're going to see from the outside, typical normal male anatomy, no real indications that there's an underlying prosthesis there. This gentleman's going to pump up his device and show what it looks like, and then we'll move on from there. So he's using 2 hands. His left hand is stabilizing the pump so it doesn't slip around inside the scrotum. And then his right hand is squeezing the pump. He's using the tips of his 2 fingers and kind of the palm of his hand to do the squeezing. Oftentimes, men will actually use their thumb and index finger to pump the device. But you can see here, this leads to a really full symmetric erection that he can have, again, for as long as he wants, whenever he wants. When he's done with the erection, he's actually finding that button. You can see it there on the backside of the scrotum. He's using his left index finger to press and hold that. It's a one touch mechanism. So after you hold it for a couple seconds, that's actually all you need. You can let go and the fluid will naturally deflate on its own. If you're in a rush, you can bend the penis like that, or actually even squeeze the shaft to reduce the erection. Okay. I had a patient who came to me with a lot of questions about the surgery, and he actually handed me a list of 30 questions that he wanted to go through beforehand. And I actually found that to be so helpful that I made a photocopy. And oftentimes when I see patients who are interested in an implant, I actually hand it to them like a homework assignment to say, hey, make sure you think about these things. It's important to really know what you're getting into with implant surgery, because once you have an implant, that is how you get erections for the rest of your life. If for whatever reason you don't like the implant or it needs to be removed, you cannot go back to using pills or shots or vacuum devices. It can be removed and replaced with a new implant, right? If for whatever reason the inflatable device is something that's not working out, maybe you had some type of injury and you can't use your hands anymore, maybe just age is catching up and it's that arthritis in the thumbs that's preventing you from using it properly. Maybe it needed to be removed for an infection that developed at some point. That can be replaced for the malleable device, the one that's a little bit simpler and easier to use, that just bends up and down for sexual activity. Or on the flip side, some guys get the malleable device and they realize, listen, I'd really prefer something that is easier to conceal, and I'm okay with trying to actually pump this device. Can we switch it out for an inflatable? And usually the answer to that is absolutely. But once you go implant, you don't go back. You can switch between different types of implants, but you cannot go back and use any other therapies. So for that reason, I really encourage guys to think about what you're getting into, really know as much about the implant as you can before you sign up. So again, we talked about the satisfaction rate is so high. 9 out of 10 people who get this thing, they talk about how they should have gotten it years ago. It's those 1 in 10 who don't really necessarily understand how the anatomy is different and how much rehab it takes to recover from the surgery that tend to be the ones that feel like their expectations have not been met. So let's talk about that in more detail. The anatomy has to do with where these cylinders go. They don't extend all the way into the head of the penis. So when the device is inflated, the head of the penis may look smaller or not as full as it is with injections or with pills. That's okay, because the shaft is still thick enough and hard enough that it's functional, that you're able to have sex whenever you want for as long as you want. So that's key, number one. Everybody always asks about the length. Okay, length is really important to guys. People who have read about implants or talked to people sometimes hear that the length changes after surgery. That's a little bit misleading. So it's important to talk about that. I always explain that there's 3 different lengths to your penis. There's the flaccid length, which is what is, in your pants on a regular basis. There's the erect length, which is the best erection from our 20s, burned into all of our brains. And then there's the stretched length, which is kind of in between those two. When we do these surgeries, you're completely asleep. The penis is stretched for as long as it can become. We grab the head of the penis, we pull it out, and then we do internal measurements, measuring from the tip of the inside of the penis all the way back to the pubic bone. And we place the largest implant that your anatomy can accommodate. So what that means is after an implant surgery, it'll always be in that stretched length. When you pump it, it'll be erect. When you deflate it, it'll be soft, but it'll always be that stretch size. And it's very important to remember that. So when you're not using the implant, there's actually more between your legs. There's more in your underwear. Some guys even have to change their underwear. Bikers often tell me about that, hey, I had to change my biking shorts after this thing. That also means when you pump it, it may not be as long as that erection from your 20s, but it will be hard enough to use for sex, again, whenever you want, for as long as you want. I wanted to go through some of these questions because I think they're really helpful and important, but I also want an opportunity to get Skip Powers in to talk a little bit more about his experience, because as you can see, I can talk all day long about these things, but I've never had an implant myself. And that's a really important and unique perspective, and something that really only somebody who's been through it before can talk to you about. So I want to go ahead and introduce Skip Powers. He's a patient of our practice who has had this himself. He feels passionately about it, and he's just going to share some of his thoughts with you tonight.
Hi, good evening, guys. Dr. Sharma, thank you. Preston, I want to thank you for giving me the opportunity to come and chat with you guys tonight. So who am I? Why am I here? How does a 20-year-old talk to a doctor about erectile dysfunction, let alone intimacy issues? As a 20-year-old, I suffered with erectile dysfunction, and as a 40-year-old, I still suffered with erectile dysfunction and chased every pump, pill, patch, treatment, voodoo, everything that we've discussed here tonight with Dr. Sharma in my attempt to try to overcome my challenges with erectile dysfunction. And it wasn't until I found a urologist and a practice that gave me the information that allowed me to make an informed decision about how to once and for all solve my issue. Let's face it, guys, standing around at the 19th hole after a round of golf, having a drink with the guys, natural conversation never moves to, hey, Ted, did you ever have a problem getting a boner? That is not natural conversation. And I'm here to pull the veil back around the secrecy of what really happens to guys that are suffering from erectile dysfunction. And once you make the decision to receive an implant, what that entails. As Dr. Sharma alluded to, I'm an actual patient of Chesapeake Urology, and I was fortunate to stumble upon them, and I found a doctor that was empathetic, a practice that was collaborative, they were engaging, and they made me, the patient, feel confident that the juice was worth the squeeze. As Dr. Sharma alluded to tonight, it's important for you to find a physician that is more interested, not just in what the outcome is, but what you as the patient are going to achieve. What are your goals? Why did I wait so long? Dr. Sharma alluded to the guys always come back to saying, I wish I would have done this 20 years ago. How true that is. After chasing every pill, pump, patch and treatment available over the last 25 years, I can tell you that it really became a wedge in my own personal marriage, to the point that my wife and I was finding myself making excuses to my wife several days in advance about why we couldn't experience an intimate moment. And it wasn't until I stifled my pride to talk about more permanent treatment options that I can tell you that my life has changed, and my intimate life has taken a dramatic turn for the better. I want to talk to you really briefly about the facts and the fallacies, and Dr. Sharma's really talked a lot about them. I'm here to tell you guys, fact, it works. There is no two ways about it. Everybody saw the video, within 12 pumps, and it's different for every guy based on your own dexterity. Within 12 pumps of that cylinder, thumb and forefinger, I have gone from flaccid to fully erect, capable of penetration and ejaculation. Fact. The procedure and the recovery is uncomfortable. It is uncomfortable. It is a procedure. And for the first couple of days, you are going to feel quite sore. For the first 2 weeks, while you're starting to cycle the device through the recovery, it is going to be uncomfortable. Pain is a spectrum that is different for every person. For me, the pain hovered around a 6-7 for the first couple of days. By week 2, that pain was down to less than a 5. When you started cycling the device, the pain stayed around a 5 or a 6. By week 3, the pain and the bruising and all of the swelling had kind of subsided. By week 4, I was cleared for sexual activity. And guys, that was 3 years ago, and I am using my device on a much regular basis. Fact. inflation becomes part of foreplay. It's immediate. No longer do you have to wonder, will it work? Will the pill work? Did the glass of wine that I had for dinner contra react with the pill or the prescription? The penile implant, it is immediate, and it will stay as erect as you want to go, well after ejaculation. Some of the fallacies: ejaculation or sensation are gonna feel unnatural. That is absolutely a fallacy. Guys, you are going to be able to ejaculate, and I love the analogy that Dr. Sharma gave about water pressure. If you turn the faucet on a little bit, the water comes out a little bit. If you open the faucet fully, the water comes out fully. Following that same logic, when you're operating with a fully erect penis, I am here to tell you that I've experienced much stronger ejaculations since having my implant. Fallacy: everybody in the locker room is going to know. Everybody that sees me at the pool wearing shorts, they're going to know. That's a fallacy. The only people that are going to know are those that you want to know. You are going to look the same in the locker room. You are going to look the same in shorts. You are going to look the same in your skinny jeans, if that's your thing. Nobody is going to know. The only individuals that know about my implant are those that I have shared, and that rarely extends beyond the medical cadre that I have. Fallacy: inflation is awkward and it's difficult. It does take some getting used to. However, I can tell you that like anything, practice makes perfect. You can go from flaccid to erect in about 20 seconds. You can go from fully erect back to flaccid in even less time. Fallacy: as Dr. Sharma alluded to, you can only work with what you got. You are not going to lose length, but I can tell you that I didn't lose length, but I definitely gained girth. And that, again, going back to the open faucet analogy, if you can imagine that you have now are using a device that is helping to put fluid into your penis, you're going to be a grower. The procedure, Dr. Sharma has kind of talked about it. Guys, I can tell you, my wife dropped me off at 6 a.m. at the surgery center. By 10 a.m., I was home in my bed watching TV with a bag of frozen peas on my nads. It's a simple IV and general anesthesia procedure. It was 2 hours from the time that I had gone through pre-op till I was in post-op. And I can tell you that the pain persisted for about 4 to 6 days. You are going to at some point look down and say, what have I done? And I'm here to be that patient advocate to tell you if you can, if you have any questions, if you're concerned about what the pain or the procedure might yield for you, contact me. I'm here to answer any questions. But I can tell you by week 4, when we were cleared for Shangri-La, it coincided with my 25th anniversary, and my wife and I enjoyed a trip to Key West. By night 2, a quote from my wife was, "It's time to put your toy away." Guys, my only regret is, why did I wait so long? There's a lot of questions that you have, and I am here to be as candid and as direct with any of your questions. Nothing is off the table. My contact information is on this slide. You are free to contact me by email. You can call me, you can text me. I look forward to talking to each and every one of you and continuing to be a patient advocate, not only for Chesapeake Urology and Boston Scientific, but for anyone that is considering this type of implant. To that end, I want to thank you for your time, and I turn it back to Dr. Sharma.
Skip, thanks so much. Every time we talk, like, you share something so intimate in such a kind of simple way that people, I think, can really relate to. And I can't tell you how much I appreciate you sharing that, because again, I can talk about this from the surgeon perspective. I do these for a living. I do these routinely. I take people and help people through the recovery process. But having never gone through it myself, you can really talk about it in a way that I think people can and should relate to and appreciate. There's a couple more slides here that we're just going to get through quickly. I do want to talk in, a little bit about how long the device lasts. It is really designed to be durable. Almost 90% of these are still in use after 10 years. I actually just coincidentally had a patient my partner saw who was using his implant 25 years after it was placed, and it was still working great. Okay, obviously everybody's results are going to vary. I have seen people need revision surgery as soon as 2 or 3 months afterwards for some rare complications like a device herniation. I had one patient who returned to sexual activity too early, and that balloon that's supposed to hide behind the pubic bone popped out because they didn't listen to the post-operative instructions properly. That was something that needed to be put back in, and luckily we were able to do that without much issue. Sometimes in rare circumstances, there can be implant infections that pop up early. I've had that in patients who, have exposures to, certain bacteria, whether it be healthcare workers, whether it be people who work around animals. Sometimes that can predispose us to having certain bacteria on the skin that somehow find a way in and coat onto the implant, despite all of the precautions that we take. But then, I've had people who use their implant for years and years, and, by the time we're doing some type of revision, 25 years later. So we don't have a crystal ball. It's hard to predict how long, your implant would last, but these things are really designed to last thousands of cycles, and they're really designed for rough use too. People are always asking about, hey, am I going to break this thing? And the answer to that is definitely not. Okay. If it breaks, people ask, like, what's in it? Is something bad going to happen? Is that going to, react with my body in some way? The fluid that we use is injectable saline. So it's not like we're putting battery acid in this thing. Like, if it leaks, it's totally the same as the physiologic fluid that you have in your body. It'll make it so the implant doesn't work anymore, and we'd have to go to surgery to fix that. But the fluid itself and leaks are not dangerous. It just causes the device to not work anymore. We talked about satisfaction rates. Affordability is important because, again, a lot of these advanced treatments, like the injection therapy and the suppository, is going to be quite expensive. Shockwave therapy that we talked about initially is quite expensive, can be more so than, what an implant is when you have insurance coverage. And again, this is just something that I honestly, truly believe is the closest thing that we have to like a cure for ED, right? It makes you independent of relying on pills, relying on an external source to be able to use your penis in the way that you want to.
Hey, Dr. Sharma, can I interject real quick?
Yeah, absolutely.
Gents, this is an area that I think that prevented me from pursuing such an aggressive treatment option. Was worried, will my insurance cover it? Could I afford it if the insurance didn't cover it? Would my employer know? And I hear a lot of guys concerned about those same issues. At the end of going through all of the prescription treatments, my out-of-pocket expenses every month for 4 pills was costing me $300 after insurance. My penile implant cost $300 out of pocket after I paid the $200 copay for my surgical center visit and $100 copay for the anesthesiologist. My insurance covered everything else. That's an important fact. Because a lot of insurance companies are now understanding that ED is very treatable from a cost benefit perspective. For someone that is going to benefit from having a penile implant for as many years that I'm hoping to enjoy having this, the pills versus the implant makes sense for them. My employer did not know. I never had to get pre-certified. The practice was competent enough and had the staff to take care of all the liaise required to get all the approvals. All I had to do was show up. So that's an important footnote.
Thanks a lot, Skip. And, just a 2 cents on that, everybody's experience is going to vary, right? So luckily, some generic pills are not as expensive as they used to be. And, private payers can always be a little bit tricky as far as coverage. But listen, the first thing that we do is really just assess if this is medically appropriate. If you get to the point where you have a recommendation from a urologist that this is something that you should really consider and something that we recommend for you, at that point it's just a matter of convincing the insurance companies that like this is really something that should be a covered benefit. And for Medicare, it's quite simple. It is, and it ends up being a 65th birthday present for a lot of my patients who don't get the same luck with their private payers. But coverage is a big consideration. And again, our offices can help understand what kind of your individual out of pocket would be based off your coverage and copays.
Awesome. Thank you, Dr. Sharma. Thank you, Skip, for both of your wisdom. We're going to go ahead and open everything up to question and answer period now.